There we are. Can you see that properly?
Perfect. Yeah,
okay,
perfect.
Lovely. Thank you very much for that introduction. As Tonya said, my name is Elizabeth Forsythe. I'm one of the clinical geneticists in London, and I'm going to be talking today about the setmelanotide study, and really I'm presenting this on behalf of the clinical team. And to give you a bit of an overview, I'm going to be giving you some details about how, just a bit of the kind of scientific background on how hunger works, in general, what's different in people with BBS, how setmelanotide works and how this new drug and how it helps to cause weight loss, and to give you some more information about the trial. So first of all, how does the body feel hunger? And really the secret to this is to be found in this tiny little part of your brain called the hypothalamus. So this part of your brain, the main job of this part of your brain is to control, to balance things in your body. And it balances lots of different things. So it's in charge of balancing your body temperature, your sleep cycle, and your blood pressure, but also your hunger levels and your appetite. And the way it does this is by sensing signals that come from all different parts of the body, and then picking those up, and then weighing up what the best response is, and then sending out some other signals in the form of hormones, generally, to tell the body how to regulate things. And in terms of regulating your hunger, your appetite, it's quite a complex process. So hopefully you can see this is a medical diagram of how hunger is regulated, and I'm not going to go through it in detail. That isn't the point of the slide. It's really just to show you that there are lots of different organs that are involved in this. It's quite a complex thing, and there are lots of different pathways that are important in regulating your hunger, and all these different signals from different organs feed into your brain, and then tell your brain how to regulate the hunger signals. And I wanted to give you just a bit more of an insight into what happens in the brain in terms of your hunger signals. And so this is the bit, for those of you who can see it, this is the bit that I circled in green. And that's the bit here that's enlarged. So the upshot is that when you're regulating your hunger, there are some signals that will increase your appetite, and then there are some signals that will decrease your appetite. And the bit that we're really interested in this study is this particular bit here that I've circled a bit in red. It's the melanocortin-4 receptor pathway, and that's part of a pathway that decreases your appetite. And the reason why that's a really interesting pathway from our point of view is because we think that's the one that doesn't quite work properly in BBS. So it's no wonder if that pathway isn't working quite that well, so your ability to decrease your appetite and actually feel that now you're full, if that's not working properly, it's no wonder that you feel full, and as a result want to eat more food. And what's really exciting about setmelanotide is it works on this particular pathway that doesn't seem to work particularly well in people who have BBS, and sits there and helps ensure that this pathway works better, and so that there is a better balance in terms of the food intake and what the body needs. So I wanted to give you a bit more information about the trial, and I think yesterday Dr. Bob Hawes talked a bit about the trial in the States. And actually, this clinical trial is taking part in lots of different places in the world. So there are lots of different centres who are involved in this. And to give you a bit of background on clinical trials, there are sort of three different parts to it, or three different phases. So the first phase in a clinical trial is a safety phase, where you take just a few people and you look to see, is this drug, is it safe? And the second phase is a safety and dosing phase. You take a few more people and you look at the safety of the drug again, and you look at the dose. And then the third phase is where you look at safety and you also look at efficacy. So what that means is, how effective is this drug in in doing what we want it to do. So in the case of setmelanotide, we're looking to see how effective is it in reducing hunger levels and also reducing weight. And this here, this phase 3, that's where we've got involved. So the study that we're doing at the moment is a phase 3 study. And we're doing the study at St Thomas's Hospital in London. And we have 2 participants who are taking part in the study. Overall, in the rest of the world, there are quite a few more participants, but we have 2 participants. And we started taking part in this trial in March 2020. But because of coronavirus, we had to stop it for about 6 months. So we almost got started, then had to stop it. And then we were allowed to restart it at the end of September. And we've been going ever since. And I wanted to tell you a little bit about how the trial works. This particular drug, setmelanotide, is a drug that you have to draw up and inject every day into the tummy. And the participants are also asked to log every day in what we call a hunger diary, how hungry they feel on a scale. And also they have to log whether they've remembered to take the drug on that day. And there's a diagram underneath here that shows the trial setup effectively. And what it shows is that for the people who've taken part in this trial, for the first 14 weeks, they were in a part of the trial called the double-blind treatment period. And what that means is that they are either randomly assigned to have the drug or to have a placebo, which means they're not having the drug, but they're still injecting something that doesn't have any active drug into their tummy. And that component of the trial is there to ensure that we get some unbiased results. Now, the next part of that trial, so they did that for the first 14 weeks, and the next part of the trial is what we call an open label treatment, so that both the doctors and the participants know that they are getting the treatment with the drug. And actually that bit was, this part of the trial has been cut short, and the participants are now what we call the long-term extension trial, so they're both having the drug now. But as I told you already, this is already going on in other parts of the world. And actually, some of the other centres in the world were started the trial earlier. So they've already had some preliminary results back, whereas we have not been going for that long. And here are some of the results of the international study. And this particular study included 31 patients who were who were 12 years or older. 28 of those patients had BBS and 3 had Ulstrom. And what it showed was very encouraging. It showed that there was a significant decrease in weight and hunger. It also showed that adults with BBS had an average weight loss from the baseline of about 10%. So what that means is if you weighed 100 kilos, say, at the beginning, then after a year, there was a weight loss of about 10%. And there was also a very good effect in children. So the participants between the ages of 12 and 18, we measure weight changes slightly differently in children because we expect them to increase in height over a period of time, but the effect in the children was also good. And I wanted to give you some input from what our participants in the study said. So I asked them this week earlier to say, could you give me your honest thoughts, give me some honest feedback on what your thoughts have been so far about the trial. And one participant said, and I'm afraid I've had to condense because they both had lots to say, which was great, but I've condensed it. So one participant said, since being on the trial, I've seen a difference in my body shape. I feel much more confident. I don't feel the urge to keep visiting the fridge. And on the slightly more challenging side, the participant said, if you have little or no sight, you would need daily support to administer the drug and complete the daily paperwork. And here are some other comments. One participant said, the trial has really benefited my life as I am nowhere near as hungry as I used to be. The weight keeps coming off. And when I got into a smaller size, it gave me so much confidence. And then I think this is probably my favorite quote. So this participant says, "Everyone says how healthy I look due to the lovely suntan that has appeared due to the drug." So that's one of the side effects of the drug, is that you get a change in skin color, tend to turn a little bit more darker or a bit tanned. And this participant said, "Everyone thinks I've been away, but obviously haven't, as I've been in lockdown and I've had to shield. So I say I've been to Dubai for a month, haha," which I thought was brilliant. And in terms of moving forward, what's next? Well, so this was announced, I think in November, that there is a weekly formulation that's being developed for this particular drug, which I think would be, if that becomes available at some point to our to the BBS community, I think that would be great, because I know we have a lot of people in the community who would be interested, but equally there are a lot of people who are living very independent lives, and therefore do not have a carer coming in every day who could help draw up this drug if they are visually impaired. And I wanted to finish off by saying a big thank you on behalf of the clinical team to our participants, because although I think it's been really exciting for all of us to take part in this trial, there's also there is some anxiety around the unknown and taking part of it and trying a new drug. And also I think our participants have gone way above and beyond, and have still continued to come in to see us at St Thomas's, to travel in to see us at St Thomas's during the pandemic, and when it was at one of its peaks, even in January. So very grateful for that. And that's it. I'm open to questions.